Hello, viewers. Happy Friday to everyone, and welcome to our Facebook Live session on lung health in observance of Lung Cancer Awareness Month. My name is Diana, and I'm a wellness coach at Baptist Health and will be acting as a moderator today. I am so excited to have this wonderful expert panel with me today, and I invite everyone to tune in for the entire session if you can. And if for some reason you missed all this awesomeness today, you can catch it later after we're done. So there's going to be a lot of great information shared, and we welcome everyone to join in on the conversation today because it is a very important topic. So feel free to drop a comment and let us know you're here, and I'll be monitoring the comments. So if you all have any questions, we'll make sure that we address them. So without further ado, I'd like for you all to meet our expert panel, and I'll have Dr. Modi kick us off.
Hello, everyone. Welcome. My name is Aakash Modi. I'm an interventional pulmonologist at Baptist MD Anderson.
And I'm Carolyn Baggett. I'm the lung cancer screening program coordinator for Baptist MD Anderson.
Hi, everyone. My name is Kristal Fuentes. I'm a health promotion specialist at the American Lung Association.
Okay, excellent. Thank you all so much for taking the time to be here today and to talk about such an important topic. We are truly honored to have you all here. So November is Lung Cancer Awareness Month. And with any health observation, I feel like it's a great opportunity to learn more about that health focus, local resources that are available, and the latest treatment that people may not be aware of. So we've put together this panel to not only showcase the importance of this topic, but also to illustrate how organizations work together in this cause. And I think it's important for people to see the local collaborations that are happening. So panel, can you share with the viewers a little on how Baptist and American Lung Association collaborate?
Diana, I can definitely take that one. Baptist Health and Baptist MD Anderson are a huge partner with the American Lung Association. We work together in our Lung Force Initiative, which our Lung Force Initiative is to raise awareness for lung cancer. Really, we would like to let people know that you don't necessarily have to have been a smoker to get lung cancer, but that's one of the biggest misconceptions. You can get lung cancer from radon and various other reasons. We are also working with Baptist in support with our speakers for different presentations that we have, like our Lung Force Expo, which I can kind of highlight a little bit later on. But essentially, it is an event where we educate the community, we educate nurses, respiratory therapists, health educators about lung cancer. And so we really work together to make sure we educate the community about lung cancer. And Baptist is, again, a great supporter in our work. And I really feel like it definitely amplifies our message. So.
Thank you, Kristal. It's really great to see this in action in the community. As you may know, Kristal, I do have a background in public health, so this is really incredible to see. So we know that we have the community tuning in, and I think it's important for people to understand the magnitude of the problem because, like Kristal mentioned, it is a misconception that you only get lung cancer from smoking. And I was really surprised to see some of the facts on it as well. So how many people are impacted by lung cancer each year, and what are the main risk factors for it?
Lung cancer is the #1 cancer killer, and it makes up 22% of all cancer deaths. The problem with lung cancer is that it's typically found at a later stage when you have symptoms. So if it's found at an early stage, the 5-year survival rate is 61% and goes up to 92% if it's found in stage 1A. And if it's found in stage 4, that survival rate plummets to just 6%, which is pretty devastating. Men are at most risk. And individuals who are highest at risk are former and current smokers. More than 80% of lung cancers are caused by smoking. And even when you quit, you're still at risk. So we still watch you for 15 years after you quit.
Oh, thank you so much, Carolyn. That some of that information is really alarming. And that's what is really important for the community to be aware of. So, Kristal, tell the community why lung health is so important.
Because breathing is living. Our lungs are so important to our overall health, and so many factors can affect the health of our lungs. Environmental factors like pollution or smog, behaviors like Carolyn mentioned, smoking, and even vaping. A lot of people are thinking that vaping is healthier, and it is not. So we're seeing those effects of vaping already. And I don't have to tell anybody about viruses. We have already experienced that. It has turned our world upside down.
Right.
COVID-19, obviously, that's a whole nother topic that we could go on about. But the American Lung Association, we're here to be your trusted champion for education, for research, and advocacy for all lung health. And, we really want to make sure that we're here for you, and to make sure that you guys know that lung health is very important, and we're here.
Thank you so much, Kristal. So, Dr. Modi, I'm curious about what are some of the signs of lung cancer, or the early signs. Can you please share that with the viewers?
Sure, absolutely. Before I answer that important question, Diana, I'd just like to hop on to that important question. I think you have to classify risk factors. So smoking is one of the leading risk factor. It's very important. I think the entire community in the world have appreciated that. And then you have to classify them otherwise as environmental risks or toxins. Some were elicited like radon. If someone has high-risk professional careers that will receive radiation, so that's another category. Environmental pollutions, if you live in a metropolitan city that has a lot of pollution, you can actually develop lung disease. Otherwise, it would be hydrocarbons, for instance. That's one category. The other category would be you have to account for genetic risk factors. You have a category of subset of patients that don't have history of smoking, for instance, but do develop cancer. But then we account for genetic risk factors. The other categories of patients have underlying lung disease, and that does not necessarily have to be smoking related. If they have an underlying lung disease such as pulmonary fibrosis, for instance, I'm just naming one for an example, but it's important to understand underlying lung disease makes it a slightly higher risk for development of lung cancer because you lose a cell checkpoint, which is what's required at the molecular level, where cells are constantly growing and dividing, and they have a death process, and that's taken away. And that's one of the reasons or hypotheses why someone develops lung cancer. Now, coming back to your important question, early signs of lung cancer. So if you are to look at various literature, we have two big categories, or two symptoms rather, that are very common. One is a cough, and the other one is shortness of breath. And those are very commonly seen in some of those patients. And initially, if those are the symptoms that persist after several weeks, and you suspect that you may have an infectious cold or a bronchitis or a pneumonia for which you were treated with antibiotics, but if those symptoms persist despite treatment, that is one early sign that I would recommend every viewer to actually speak to their primary care provider to get an imaging study such as a chest x-ray. That is one early finding. The other symptoms to keep in mind are weight loss, unintentional weight loss precisely. Some patients, if they have aggressive early signs of lung cancer, can cough up blood. Others could have hoarseness of voice or change in voice. Some can have bone pain, but the latter three are usually very uncommon.
Okay. Thank you so much, Dr. Modi. Those are so important for people to understand. And so if anyone out there is, perhaps concerned about some of these things, Carolyn, can you tell the viewers a little bit more about how they can prevent lung cancer and what screenings should they ask for?
So lung cancer screening is a newer screening. It was just approved by insurances a couple years ago, and it's a low-dose CT scan. Only takes about 10 minutes in and out. So if you are age 55 to 77 and you have a smoking history, you could be eligible. So it's important to talk to your primary care provider so they can see if you're eligible. If you are, insurance covers it at 100%. And the goal is to find lung cancer before it shows any symptoms, when it is curable and it is tiny.
Thank you so much, Carolyn. And Dr. Modi, can you walk us through what someone would expect going into a lung cancer screening?
So I think it initially starts with understanding risk factors. Carolyn elicited some of the very important key features. So one component is smoking history. So I'm going to track back just a second. These lung cancer screening guidelines came about after large randomized clinical trials performed in the United States, and one came out of Europe more recently that actually emphasized on getting these screening scans done on patients that have high risk of developing lung cancer. And one of the most important features that came out of the study was it was isolated, and we emphasized and it echoed back the most important point that smoking is the leading risk factor. So if patients have a 30-pack year smoking history and continue to smoke actively or have quit within the last 15 years, should absolutely consider this screening. Now, the process involves a discussion. The first question is, if you're willing to consider this, it starts with a discussion with your primary care provider, or even if you have a lung disease underlying for other reasons, a discussion with your pulmonologist, for instance, or any other physician for that matter. If you initiate a discussion, that might actually lead to the pathway of undergoing screening. That involves a discussion between a provider, a physician provider, or an advanced provider with the patient, and understanding the risks and benefits of screening. So with this CT scan screening that is performed, the radiation is not as much as a normal CT scan. Mm-hmm. And that's extremely important to appreciate, because that is a very common question we receive. Am I going to develop lung cancer from lung cancer screening from the radiation? It's a very valid concern, and we appreciate that. But I want to share some numbers on it. Patients that actually go through annual lung cancer screening CTs, for men, the risk of developing lung cancer is 0.07 compared to 0.14% in women. So it's not as high comparing to the risk versus the benefits of getting screening, because our goal for screening is to catch lung cancer as early as we can, most importantly, because as early as we catch it, there's a better chance of having cure. And that's the goal. So it involves a discussion. It involves understanding the risks, like I mentioned. And then we schedule a CT scan. You undergo the CT scan, and we're happy to see any patient that undergoes a CT scan, or even just the initial discussion if needed here at Baptist MD Anderson, to actually talk about that.
Okay. Thank you, Dr. Modi. That's so, the fact that you expanded on that for the viewers is really important. And I'm going to ask a question here for myself, really, just out of curiosity. So if, for example, I don't have any risk factors, or say the clinician doesn't necessarily categorize me as having risk factors, but I'm still interested just because I have some concerns, what would I do? Is it even possible to have a screening done?
So screening can be performed outside of the guideline criteria. Our current guideline criteria is rigid because it's everything is evidence-based as we practice medicine in the United States. However, if there are other risk factors that, like you elicited, that may not be very evident as determined by those guidelines, it becomes a discussion between you and your provider. Okay. And you can actually undergo having another CT lung cancer screening just done even for the first time. It does require financial money out of pocket, because it's out of guidelines, so insurances may not cover it. And if I recall correctly, please correct me, Carolyn, it costs about $115.
That is correct.
Okay.
But again, it's important to understand this, and I emphasize, please don't get a CT without a lung cancer screening CT without discussing with your provider, because it's a very important discussion to understand the risks, benefits, why, and how, for instance.
Thank you. Thank you for emphasizing that. Carolyn, how does someone go about making an appointment to get a lung cancer screening?
So it is a little different. As women know, we can walk into any mammogram facility and we don't need a doctor's order. Unfortunately, with lung cancer screening, you do need a doctor's order. So you will have to go see your primary care provider to obtain that. We do lung cancer screenings at all 10 Baptist locations. So from Clay to Nassau to Beaches, there's imaging locations all over the place for you to get your screening. And like Dr. Modi said, if you don't meet the criteria, just let the people know at the CT technologists know at the imaging facility that you are a self-pay patient. and that's $115, and then we will bill you later for that.
Excellent. Thank you so much. So I'll pause just for a second because we have quite a couple comments, not necessarily questions, but just things I wanted to share. And then Kristal, then we'll turn it over back to you. We'll turn it over to Kristal. So we have a hello from Michael. Michael actually is the manager of our team. And then we have a hello, good afternoon from Carrie Jones. And Carrie also says, I highly recommend MD Anderson and Dr. Modi. So really, really sweet and great to hear. So Kristal, tell us a little bit more about the American Lung Association and what they're doing in the community.
Well, I want to kind of go back real quick to something Carolyn was mentioning. I know most of our viewers are here in North Florida, but I know I have, family members from all over the country. And if you have a friend or a loved one that you think could benefit from a screening that you're hearing about Carolyn and Dr. Modi talk about, I just want to share a resource that the American Lung Association has that is accessible to everybody. And it is what we call our Saved by the Scan initiative, and it's savedbythescan.org. So essentially, like they were talking about, the earlier that patients are screened, the better chances of their survival and treatment. So there, they can actually take a quiz that takes them through all those risk factors that Carolyn and Dr. Modi talked about, and they just answer yes or no to those questions. After that quiz, it will kind of determine if they're at high risk or not. And they can then find a lung cancer screening by entering their zip code into our tool. If it does say that they're high risk, they can download a conversation guide for their doctor that they can go over with. And even if they're not high risk, like Diana, you were talking about, it still gives them a conversation guide and to talk with their primary care physician to really see, maybe they just are really concerned and maybe may not be high risk, but they really want to check. So that is something that is available. Again, it's at savedbythescan.org. It's very simple to go through. You just yes or no questions. You can do it from a phone, desktop, tablet, any of those things will work, and it's very accessible.
Okay. Excellent. Thank you, Kristal. So to the viewers who are tuning in right now, Kristal mentioned a link. And so if you look in the comment section right now, it's listed there. It's savedbythescan.org. So if you need that information, make sure you just copy and paste it into your browser and you'll be able to look into it there. And we also have a question from Lisa that I'm going to throw out to our panel. How big of a factor is secondhand smoking?
I can take that one. I think it's significant. There are a lot of factors that need to be accounted for secondhand exposure, such as the extent of secondhand exposure, the duration, for instance. The truth be told, there's no clear guideline or evidence to suggest how much or what quantity or what extent or what duration of secondhand exposure is high risk, intermediate risk, or low risk. And that's a bit of a clinical conundrum that every physician faces, or every healthcare provider faces in the country or the world, rather. So what I usually recommend to some of my patients when we have that discussion is we go through the risk in detail and we come up with a plan together. And if the goal is, there are other risk factors to account for, but if there's significant risk of secondhand exposure, I do recommend lung cancer screening. Yes, it may not meet guideline. We could figure out something if there's financial burden, because yes, it's out of a pocket expense, but then it could be considered a lung cancer screening CT still.
Excellent. Dr. Modi, thank you for responding to that question. So Kristal, how can someone get involved with the American Lung Association?
Well, going to our website, there is a plethora of information on our website, lung.org, with lung cancer in, even if you don't have lung cancer, if you just kind of want to learn about it, or maybe you're a caregiver of somebody with lung cancer, there's all kinds of information that you can look up. There's also our Inspire community, where you can actually chat with other people in the country who may be going through the same things you are in lung disease and lung cancer and all of that. Quitting smoking is another one that we have a very active community with people. And in these times where we're so isolated, sometimes it's nice to reach out and make some acquaintances and friends in places you might not have ever looked before. I know, being at home all the time, not going out with friends and, going out to dinner and things like that, it can be isolating and you kind of don't know where to turn. So our community is here for everybody. Ways that we can get involved. We actually have right now going on our virtual Lung Force Run Walk. Normally we would have it in August, which is usually a hot time to do it, but we would have our 5K run walk. But this year with our pandemic, we wanted to make sure that it was virtual. We wanted to make sure we were staying safe. And so right now we have a virtual campaign that goes towards research and awareness campaigns. So right now you can go on our website to join our virtual Lung Force Run walk in your neighborhood, use those lungs. That's really all it's about, is just, awareness and raising money for research so that we can make sure that new treatments are created and lives are saved.
Thank you, Kristal. And so for the viewers, I just want to let you know I signed up for the virtual 5K, so yay. I have to complete it before the end of the month. And so if you all have not, I encourage you to go ahead and sign up. It's really for a great cause. And so, if you don't have to run, you can walk, like Kristal mentioned. And if you're concerned about COVID, which is very much still, a concern, you can, do it by yourself or, have fun with your friends virtually, have your phone with you the entire time, FaceTime with a friend and do it together. I wouldn't recommend running and FaceTiming together. That can cause something else, but, right. Please go ahead and sign up, and it's gonna be really nice. And it's, like I said, it's for a great cause. Now, we do have another question from Lisa, and she wants to know if lung cancer is predominantly an adult cancer or if you see lung cancer in children.
I can take that one. So yes, there is lung cancer that is seen in children. To be very honest, I don't have the statistics on top of my head. However, so you have subtypes of lung cancer. If someone is diagnosed with lung cancer, there are categories. For instance, I'm just going to give two big broad categories, not to go into depth about it because that's not the focus. It's small cell, non-small cell. Now, there are a lot of subtypes within those categories. In children, those categories are very different. The risk factors for children also are different compared to adults, as you could expect. Genetic risk factors are a little higher, particularly for children. And there could be other cancers that could actually, if children, for instance, have cancers from outside the chest, they could spread to the lungs. And that can present as lung cancer as the first manifestation. So it does not necessarily have to be true lung cancer.
Okay, thank you. And thank you so much, Lisa, for all those great questions, really important questions. So I'll pause for a moment to see if any one of the viewers want to add in any more questions or comments. In the meantime, while I'm monitoring that, our expert panel, just want to throw this out there. Do you have anything else you'd like to add into the viewers? Anything that you feel like is important to mention at this point?
I think it's important for people to understand that delaying a cancer screening can be very detrimental. I know everybody's afraid to go anywhere with COVID-19, and we totally understand that. But if you delay your lung cancer screening even by 6 weeks, your cancer can be found at a later stage, and it increases the mortality rate by 14%. Baptist has taken many steps to keep you safe. We're probably cleaner than we've ever been. We do temperature checks at the door. We have a mask requirement. There's social distancing in the waiting area. We have hand sanitizer stations, and the CT technologists are cleaning the scanner in between each patient. So we are going above and beyond to make sure you are safe when you come in for your cancer screening. They are anticipating by year 2030 that the cancer mortality rate is going to be higher because people have not received their cancer screenings during this pandemic period.
Thank you, Carolyn. Very, very important. Sorry, I hear an echo. There we go. So we have a question and then we have a comment. I'll mention the comment. Carrie Jones to Dr. Modi. Dr. Modi is one of the reasons that I'm cancer-free today.
She's very kind.
That's awesome.
It's my honor to be involved in your care.
I hope you heard that, Carrie. And then we have another question from Lisa. Are there specific resources in Jacksonville for patients with lung cancer, financial support, case management, etc.?
I can kind of mention some of the things we have working with American Lung Association and specifically with Baptist MD Anderson. As I mentioned already before, we have a ton of education on our website in any stage of diagnosis and even for caregivers. We recently just had, again, because things are a little bit, we have to be virtual. We just recently had our lung cancer virtual patient meetup. That was held on November 8th, and it's still accessible for viewing. We have that link. We can provide it as well, and that was really about education with the different mutations for lung cancer. We won't kind of go into the details of that, but we do have lots of education for that. And then the American Lung Association is partnering with MD Anderson to deliver Courage kits that are for newly diagnosed lung cancer patients. And so I think Carolyn can share a little bit more about some of those Courage kits and then the resources that Baptist provides.
Thank you.
The Courage kits were developed by lung cancer patients for lung cancer patients. So there's a lot of comfort items, and it's in a reusable bag, and it provides like a water bottle, blanket from when you're getting chemotherapy, coloring book, journal, all things that'll help you through your cancer journey. And so we are obtaining names for new lung cancer patients if they're interested in that kit, and working with American Lung Association to get them that Lung Force Courage kit.
Okay, awesome. Thank you. Dr. Modi, Carrie said she will see you in 3 months. So I don't see any more comments at this time. But, I hope that the people tuning in learned a lot today. I mean, I certainly did. I learned things that I honestly did not know. So I just want to thank you all for sharing your knowledge with the viewers, with the community. Before we end for today, I would just like to let everyone know, in the comments section, you can see all the links that we posted for the information that the panelists spoke about. And then within our Healthy Living Centers, we have each of our centers are staffed with a wellness coach, RN wellness coaches, virtual classes, free biometric screenings, and coaching sessions. So you can visit the link in our post to access all of these great programs and to sign up for our e-newsletter. And most importantly, did I mention it was free? Because it's absolutely free, just in case you didn't catch that part. And so I see here, Carrie is saying, thank you for doing this. Lisa says, thank you. And Bethany just joined us. Well, she may have been here already. Sorry. She said, excellent information. Bethany, thank you so much for tuning in. And so I want to thank everyone for tuning in today, and a special thank you to our panelists. Thank you so much.
Thank you.
For sharing your incredible wealth of knowledge. We will be resuming our Ask the Wellness Coach series beginning in January. And so we're going to take a little break because it's holiday time, and we're thinking about gifts and family and food and more food, and then we set our resolutions for January. I want to wish everyone a safe and healthy holiday season. So happy Thanksgiving. Look out for Facebook events on the Baptist Health Jacksonville page for our next session. And we will see everyone next year. Thank you and have a great day.
Thank you.
Thank you.